Hi, my name is Dr. Kerry D'Ambrosio, and I started as an athletic trainer, and I became a physical therapist graduating from the University of Toronto, Canada. I later went on and studied acupuncture here in Florida and became a doctor of Oriental medicine. I then later studied osteopathy in Hamilton, in Ontario, Canada, and went on and studied classical osteopathy in Maidstone, England. The purpose of this video clip is to introduce to you our Therapeutic Systems seminar series. The focus of this series is basically on critical thinking. We are going to be using our understanding of anatomy, physiology, and biomechanics to teach you more effective ways of evaluating and treating. When you think of treatment, treatment always begins with evaluation. So evaluation starts with subjective evaluation. We are going to teach you how to take a history, looking at is it a mechanism of injury or insidious onset. We're going to take a look at, is this a mechanical cause? Was this something that was congenital or acquired? Acquired, it could have been from a car accident, a fall, your work, a surgery, burn, whatever. It could also be non-mechanical. This could be diet-related, stress-related, it could be autoimmune, could be some pathology, physiology occurring in your body, or a combination of the two. What stage of healing are you in? So we'll take a look at these factors among other factors to help make decisions. In the objective section, we use 4 letters, A-R-T-S, ARTS. The A stands for asymmetry. So we're going to be evaluating the body. We're going to look at the face, we'll look at the eye levels, the zygoma levels, we'll look at the jaw levels, we'll look at the spine, look for levels of rotation, side bending, we'll look at the angles from the side and the sagittal view to see if we have a kyphosis or lordosis. We'll look at shoulder heights, we look at the pelvic heights. We're going to look at all sorts of asymmetry in the body. What we found out is the more asymmetrical you are, the more that it affects your functional range of motion. So for example here, if Cassie had a protracted shoulder here, this would limit her ability to abduct her shoulder. Okay? If she had an elevated pelvis on that side, that would affect her gating mechanics, how she moved that pelvis and hip on that side. Asymmetry tells us a lot of clues. For example, if this shoulder was forwards, why is it forwards? It could be due to protective muscle spasm in the front pulling it forwards, or maybe some weakness at the back. Maybe there's a joint that's restricted here, there could be swelling. So again, looking at asymmetry gives us lots of clues, but doesn't really tell us what the problem is. We have to go on to the R, and the R stands for restriction and range of motion. In our classes, we're going to teach you how to evaluate range of motion of the cervical, thoracic, and lumbar spine, the rib cage, the upper and lower extremities. When we take a look at range of motion, we always start off with active, and then we do passive. We always evaluate the unaffected side and the affected side. So let's say with Cassie here, that she only can lift her arm maybe to 90 degrees. The key thing we need to determine is, why is she only able to lift this arm to 90 degrees? What's the nature of the barrier? So we go back to our school and we find out that there's different types of end feels. If we lift her arm up and it feels very heavy and it feels sort of soft and boggy, that tells us there's swelling. And the techniques that we can do if she has swelling in this particular area is fluid drainage techniques. We can do lymphatic pumping techniques and also lymphatic drainage techniques and fluid pumping techniques. Now, if we were to lift this arm up and it is no longer soft, but it's a hard end feel, it comes to a solid end feel, this would tell us it could be more joint related. And if it's more joint related, the techniques that we could use are muscle energy techniques, mobilization techniques, osteoarticular techniques. We teach you those in the total body balancing class. If we were to lift this arm up and it's not soft, it's not hard, but it has a springy end feel, we'll call that a firm end feel. It could mean 2 things. It could mean fascial restrictions, and we would evaluate the fascia to see if there's any restrictions, and if there is, we could teach you how to do a fascia release techniques. In Upledger, they teach you cranial release. In Burrell, they teach you visceral manipulation, but we'll teach you fascia release techniques that you can use throughout the rest of the body. If it's also a firm end feel, it could be due to protective muscle spasm. So, for example, her coming up like this, it could be due to subscapularis or lat dorsi. So I would evaluate, and there could be a significant tender point. There's a technique called positional release therapy, where we take the muscle and put it in a position of comfort, thereby arresting inappropriate proprioceptive activity to settle down that muscle tension. So these are the different end feels. It's the nature of the barrier that determines what technique that we're going to use. So we've talked about A for asymmetry, R for restriction or range. There's also T for tension. So we can get in here and begin to evaluate the different joints, the sternoclavicular, acromioclavicular, glenohumeral, scapulothoracic, maybe evaluate the ribs or the spine by doing tension tests. So tension tests, they give us a lot of information, because normally a tension test, if it's a normal joint movement, it should be very springy. Okay, it should have vitality to it. If there's a restriction, then there's going to be a hard block. So we'll evaluate to see if there's any type of restriction. The S stands for sensorial changes, tenderness. So we could evaluate to see if there's any tenderness. So the key thing is, if we are evaluating for dysfunction, we're looking for 4 things. If an area is under dysfunction, there's going to be asymmetry, okay? There's going to be a restriction in the range. What's the nature of the barrier? There's going to be tension there, maybe on the different joints or bones, and there can also be tenderness. So we're going to use our critical thinking, we're going to use our understanding of anatomy, physiology, and biomechanics, along with our evaluation using our arts, to decide what form of treatment we're going to use. In Therapeutic Systems, our seminar series, we are teaching you how to evaluate and treat muscle spasm using positional release therapy, how to treat joint restrictions, that's our muscle energy techniques, fascia release, if there's any fascia restriction. We also have a fluid drainage technique class if there's any swelling. And our other class is called Total Body Balancing, and this teaches you a full body evaluation and a template to treat the whole body in about 20 minutes, and you can integrate all the other techniques into it. So hopefully this will get you interested in the different seminars. We're also going to have video clips of the different techniques so you can further understand each of those, and I hope to see you at one of the seminars. Thank you.